I'm Lisa Yen. I'm the Director of Programs and Outreach for LACNITS, and I'm here at the NANETS Regional in Salt Lake City in November 2023 with Dr. Pamela Kunz from Yale, who's the immediate past president of NANETS. And I wanted to ask you, Dr. Kunz, what is one highlight of 2023 for you?
Hi, Lisa. Well, I think that I'm most excited about the work in clinical trials that our field is doing broadly. I know you were at ESMO with Dr. Chan, and she presented the results of the CABINET trial. This will be, I think, a banner 12 months for neuroendocrine tumors. We anticipate the results of the NETTER-2 study being presented at GI ASCO. We already know from a press release that that was a positive study, but we don't know the details. And so I'm excited to see those presented, and I've been personally involved in that study. So that study looked at patients with grade 2 and 3 GEP-NETs with a Ki-67 of 10 to 55%, randomizing patients to 177 ludotatide versus high-dose octreotide, and in the first-line setting. And I think that this will be really exciting to see those results. And then I think there's another clinical trial that's launched this year that many of us, patients included, have been waiting for, the ACTION-1 study looking at actinium-225 versus investigator choice chemotherapy in patients with GEP-NETs. This is after progression on ludotatide, radioligand therapy. And this is for patients who had some degree of benefit and then have progressed. And this is the alpha therapy, or alpha emitter radioligand therapy, that we're all excited for. So lots of exciting work in clinical trials.
Yeah. So clinical trials that have recently closed, ones that we're going to hear a lot about in the next few months. What would you say is the take-home message for patients?
When I try ending most of my patient visits with what I'm hopeful for, and letting patients know that we're trying to add more and more tools to the toolkit.
More tools to the toolbox. We love that. Thank you so much, Dr. Kunz.
Thanks, Lisa.